All right, so welcome everyone. Today is a very important topic of osteoarthritis. For those who may not know, May is actually Arthritis Awareness Month. And we have a very special speaker who is returning to Olive again with yet another informative session, Dr. Bill Liu. He is a board-certified geriatric pharmacist, and he is currently supporting the County of Orange Healthcare Agency's older adult services, behavioral health programs. He obtained his undergrad degree in pharmacy from Washington State University and has a doctor of pharmacy from the University of Southern California. Bill gives presentations on medication topics to groups of seniors in the community and to senior service providers throughout Orange County by appointment. He meets one-on-one with seniors to review and assess the medications, vitamins, and nutritional supplements they are taking. So without further ado, please welcome Dr. Bill Liu.
Thank you so much, Ada. I'll share my screen at this time. There. So can everybody see the screen?
Yes.
Great. Let me... Okay, so today we're here to talk about osteoarthritis, and Sayeda picked a perfect month for it. This is the month of arthritis, and there's some new data coming out that I will share with you in just a minute. Most of my slides were provided by the American Academy of Orthopedic Surgeons. So they're very nice slides. Just as a, to begin, we can discuss that arthritis is a very broad range of diseases. There are over 100 types of different types of arthritis. Osteoarthritis is also known as degenerative joint disease or wear and tear arthritis, and you'll soon see why. Some of the other forms of the over 100 different types of arthritis that you may have heard of are like bursitis, carpal tunnel syndrome, even fibromyalgia has this arthritis component. Gout can definitely be a form of arthritis. Lupus has its component of arthritis. Psoriatic arthritis, rheumatoid arthritis, of course, very common. Sjogren's disease, another form of arthritis. So you can see there's many, many types of arthritis, of which we are going to concentrate today only on osteoarthritis. Osteoarthritis is very common in the adult population in the US. Of the diagnosed cases, we know there are over 46 million. But there are many, many people who have not gone to their doctor who have some form of joint problem, probably osteoarthritis. So the number is probably really much higher than 46 million in the adult US population. And we expect, as we all live longer, that the numbers of arthritis is going to grow even higher. They think that the diagnosed cases will go to 67 million in less than 10 years. And what's going on then in arthritis? Well, let's look at a joint. In this case, we're looking at a knee joint. A joint is articulation when there's two bones that meet each other. And when the joint is healthy and the two bones meet each other, at the end of each of the bones that meet each other, there's a smooth layer of material called cartilage. And this way, the two bones will not be touching each other, because when they do, there's going to be a lot of pain and a lot of discomfort and not a lot of mobility. So that cartilage plays a very important role. The cartilage is surrounded by a synovial membrane, which encapsulates that cartilage area. Not only does it encapsulate it, but it also provides it with some synovial fluid. And what does this fluid do? This fluid lubricates that joint. So it's like any piece of machinery. If you have two pieces of machinery that meet each other, it's going to be protected and it's going to be lubricated. And that's no different with a healthy joint. So diagrammatically, if you look at the left-hand picture, that is what a healthy knee looks like. You can see the cartilage is all nice and thick, and the bones do not touch each other. However, if you look on the right-hand picture, you can see that the cartilage is starting to break. There's risk now of the joints eventually touching each other, and that will then cause discomfort and lack of mobility. So where does osteoarthritis affect you the most? Well, along the spine, in the upper area, the cervical part by the neck, you can see surrounded by that blue diagram. Around the hips are very prone to osteoarthritis. Your hands and your fingers, your knees, of course, and your feet. So those are the most common places where osteoarthritis will attack you. And on the hands and small joints, you can also get this disfiguring nodes, and they're also painful. These are usually in the smaller joints, like in the fingers and maybe even the toes. But if you look at the anatomy of a knee, it is not only the cartilage and the synovial fluid that we've already talked about. What's very important is all the muscles that surround a joint. And please remember this fact, because later on when we talk about treatment, we're going to say why it's important to exercise. It's because of the muscles around a joint like the knee and the ligaments. If you ligament is what links holds a joint to muscle or two joints together. Like this ligament here is holding the upper joint to the lower joint. So ligaments and muscles and are extremely important, and we got to keep them as healthy as possible, especially when our cartilage is starting to fail. One interesting characteristic about osteoarthritis is that before age 45, osteoarthritis seems to attack men more than women. However, after age 45, it will attack women more than men. And so the implication is that there might be a hormonal component to this disease, and that is probably true. The hormones may affect some of the characteristics and causes of the disease. Annually, over 11 million visits are made to physicians' offices with complaints of pain in the joints, and over 815,000 hospitalizations. So you all know what most of the common symptoms are of osteoarthritis, and that is when pain is very mild, moderate, or severe. Pain can get worse when the joint is overused. Pain may improve when you rest and you exercise. And you can also experience stiffness And the stiffness in the joint can also be relieved by flexing. So the main symptoms, therefore, are pain and stiffness. And both of those then will lead to some after effects like decrease in the range of motion. So it's really a vicious circle when it comes to this disease. Like we said earlier, you may have pain, then going to the right. With pain, you're going to try to avoid moving the joint, right? So you avoid motion. And when you avoid motion, it goes then to increase muscle tightness. Not only is your muscles going to get tighter, but they're also going to get weaker. Remember that one diagram I showed you? There's all those muscles surrounding a joint. When those muscles get tight and weak, they cannot help the joint anymore. So then you have loss of motion. And so this is a vicious cycle. Pain leading to avoidance of motion leading to tightness of the muscle, weakness of the muscle leading to loss of motion. So this is a cycle that gets worse and worse until you eventually stop moving your joint, loss of motion. This may put you in a wheelchair and so on. How does your doctor then diagnose osteoarthritis? He will do a physical exam on you. He will ask you to show him or her how much you can move that joint. That's called the range of motion. That will give him an idea of how advanced your disease is. He will definitely take x-rays because x-rays are very revealing. He may also do blood tests, not so much because a blood test can diagnose osteoarthritis, but because a blood test can rule out other diseases that may mimic osteoarthritis. This way, he will know for sure if it's osteoarthritis or not. And here is an x-ray of a healthy knee on the left. You can see all that joint space, but look at the knee on the right. There's a very minimal space in parts of that knee. So this person is feeling a lot of pain. And this then is what the doctor uses to see if you actually have osteoarthritis or not. Okay. So what are some of the causes? Well, one theory is as we get older, our joint space narrows because we have less cartilage. We've used it a lot in our lives. We may be producing less synovial fluid and all that lubricating chemicals in that joint. And if we have not been taking care of the joint by exercising regularly, the ligaments and the muscles supporting that joint are weakening. Okay. And what are some of the secondary causes of osteoarthritis? Well, the two main ones are obesity and trauma. If you have been very athletic when you were young, or you were very active when you were younger, you may have the potential of having damage or cause trauma to your joint. But obesity is also very damaging to arthritis. We have what's called the 4-pound rule and the 6-pound rule. The 4-pound rule shows that for any extra 1 pound of body weight that you carry, you are putting 4 more pounds of pressure on your knees. So if you're 20 pounds overweight, you're putting extra pressure of almost 80 pounds on your knee. So you can see how that can really hurt the situation. The 6-pound rule says that for every extra pound of being overweight, you can put 6 extra pounds of pressure on your hips. And so if you're 20 pounds overweight, that's an extra 80 pounds of pressure on your hips. So the moral of the story is an ideal body weight also helps control osteoarthritis. So what are your goals? What are the goals of treatment? What does your doctor try to do? Because right now, there's still no cure for osteoarthritis. So when he treats you, what are his goals? First of all, your doctor is trying to relieve pain. When he decreases pain, the doctor will then increase the motion of your joint. Doesn't that make sense? If you're hurting less, you are more apt to move that joint. And when you move that joint, you're more apt to increase the strength surrounding that joint. Remember what we said earlier? That joint needs all the help it can get by the surrounding anatomy, and that is the ligaments and the muscles. So we want to keep them as strong as possible. When they are stronger, they will help the joint to give you more motion. So how can we do that? How can we achieve those 3 goals of treatment? Well, first, health and behavioral modifications. And by health, we mean healthier eating patterns, healthier diet, and a healthy sleep and wake cycle, because all these things are very important. Certain types of food may worsen your arthritis because they're more inflammatory in nature. For example, red meats and deep fried foods, they may cause more of the pain because they can increase inflammation, which is that swelling of the joint. Whereas healthier foods like vegetables and citrus fruits of all kinds and all kinds of fruits may decrease the pain by not causing so much inflammation. And then, of course, when you've tried healthier lifestyles and it still hasn't helped, and your arthritis is very advanced, your doctor then may decide to go to drug therapy. And for drug therapy, he has a lot to choose from. The go-to drug, because it's probably one of the safer ones of all those listed here, is this family of acetaminophen, okay? You may know it as Tylenol, as one of the brand names. This is a fairly safe drug if you are not drinking 3 or more alcoholic drinks a day. And if you're an older adult, if you keep it under 3,000 milligrams a day. Younger people can take up to 4,000 milligrams a day, but seniors and older adults should take no more than 3,000 milligrams a day. So if you're buying the 500 milligram tablets and you're taking 2 at a time, that's 1,000 milligrams. You can take no more than 3 of those acetaminophen more than 3 times a day, because that will give you 3,000 milligrams. And remember, you should not be drinking alcohol regularly when you're taking this drug. Otherwise, it's fairly safe. Okay. The second family of drugs are very, very effective for osteoarthritic pain, but it has many problems if you use it regularly, okay? That is this family of drugs called non-steroidal anti-inflammatory drugs, We call it NSAID for short, or NSAIDs. These drugs have pain-killing capability, they can lower fever, and they're also anti-inflammatory, which means they can decrease that swelling and the heat it produces when a joint is inflamed. But like I said, this family of drugs must be taken with food. If you take it on an empty stomach, you may get away with it for a little while, but sooner or later your stomach will not tolerate it, and you may risk a bleed in your stomach. When your stomach starts bleeding, then that causes all kinds of other problems, especially if you're drinking alcohol, that will speed up the bleeding. And one of the drugs in this family is aspirin, and it thins the blood. So if you're taking this a lot, then this can thin the blood. This can create all kinds of other problems. You can risk a cerebral hemorrhage if you're taking this drug regularly, especially at higher doses. This family of drugs, for some people, can also raise blood pressure and cause swelling of your body. So, and a lot of people are allergic to some of the drugs in this family. So these drugs are not designed to be used regularly, only occasionally to relieve severe pain, and upon your doctor's advice on how often to take it. Okay. Some of the other commonly known names are aspirin, ibuprofen, and naproxen. Some of the brand names are Motrin, Advil, and so you can buy these over the counter as well. If you do, you should let your doctor know and get his approval before you start using it regularly. And by prescription, you can see there's many subgroups of this drug that your doctor can choose from. Some of the more common ones you may have already heard about is like meloxicam. This is taken once a day. It's also known as Mobic. There's celecoxib. This is another drug in this family. Ibuprofen, of course, which is Motrin and Advil. This can come both by prescription or over the counter. And we have naproxen as well. So there's many drugs your doctor can choose from this family. These drugs are very effective, but they should be used only under medical supervision if you're going to take them regularly. Then, of course, if the pain is so severe, some doctors will go to an opiate, but for a very short period of time, especially after surgery to relieve arthritic issues. This is not recommended to be used for long term, but only for acute pain and for short periods of time. Some other drugs we give to complement the other drugs that we just talked about are certain antidepressants. They seem to sometimes help when given in small doses along with other painkillers. When the pain is so bad and it's already bone on the joint, some doctors will then go with a long needle and inject anti-inflammatory drugs right into the joint where the two bones meet and are touching. They will use strong steroidal anti-inflammatory drugs. This will immediately give you some relief, but not permanently. It may give you anywhere from 3 to 6 months worth of pain-free life, but the pain eventually will come back. The problem also with using this type of treatment is that you cannot do it more than 4 times a year, and definitely not more than every 3 months. So otherwise, you're going to get all kinds of other problems as well. Another type of medicine to give into the joint is hyaluronic acid. This is a spongy type of substance that's actually made from the comb of a rooster. You know, the rooster has a comb. It's that kind of material. They inject that into the joint. It has less side effects than using steroids. However, it's not as effective, and it may give you some relief for a few weeks. There are also topical over-the-counter type items that some people benefit from for short periods of time. One of them is capsaicin, as you see in this picture here. Capsaicin is nothing more than an ointment made from red hot chili. So when you apply that over the painful area, you will notice the area will start feeling heat, and that hopefully increases circulation. And when circulation is increased, pain sometimes is reduced. When you use this type of medicine, be very, very careful not to get it into your eyes. That will cause such a terrible burning sensation. So you must wash your hands thoroughly after using these medicines. There's also a new one now out, or fairly new, that contains lidocaine, up to 4%. That's a pretty high concentration. Lidocaine is the same type of local anesthetic that your dentist uses when he's injecting it into your gums before a dental procedure. So you can see that this should have some effect. And when you buy this over the counter without a prescription, 4% is the highest you can buy. Some people use this over an area before they go to bed, because you theoretically should not leave this on for more than 8 hours. And so when they wake up in the morning, they'll take it off and hopefully gotten some decent sleep. Or some people use it during the day when they're more active and they want to stay active. And they do have to remove it after 8 hours. What about over-the-counter dietary supplements? Well, there are a few that they have actually studied for efficacy, and it's a real mystery. Some people taking this stuff will find relief, others will not. So glucosamine chondroitin with MSM or without has shown some positive results for some people. They're all generally pretty safe if you're not allergic to it, and if you don't take more than the recommended dose. But one thing that's important to remember is if you do try these types of products, you should not just give up after a week or two, because they're designed for long-term use. And so you won't know if it's going to help you unless you've taken it for 4 to 6 weeks. If after 4 to 6 weeks you find no difference, then you should stop the supplement, right? Turmeric is also being studied a lot, and some studies show that indeed, when it comes to knee pain, it did as well as the over-the-counter medicine ibuprofen did. However, once again, it did not respond for everybody. So the whole idea is you can try it, and if it doesn't work, then stop it. Okay. It's generally considered fairly safe if you stay with the recommended dose. At higher doses, you may get some stomach upset and so on. Okay. And we talked already about the intra-articular treatment, that is taking that needle. Your doctor will go into the joint and use either a steroid or hyaluronic acid, which is that substance that looks like the comb of the rooster. Okay. So the next treatment the doctors will go for is exercise. And ideally, your primary care physician will uh, recommend that you go to physical therapy first, because physical therapy are experts. Those people can help you with the right types of exercise, show you what to do, and then you learn those exercises so you can continue doing them yourself. Okay. Before you go out and do your own exercise, you should get your doctor's approval, and probably he already had recommended that you do. And if you, like I said earlier, if you can, ask him for a referral to a physical therapist first. Your physical therapist will work with you on strengthening exercises and correct position. Remember, we said strength is very important because surrounding that joint are those muscles and those ligaments that need strengthening. Okay. There will also be exercises to improve your flexibility, your aerobic exercises to increase your endurance. And some important things are, don't exercise when your pain is at the worst or when you're really tired, because then you're easy to get into an accident, or when the effect of medication has worn off. Okay. It's always good to have a warm-up period and a cool-down period. Start slow, progress gradually. Don't do too much too soon. And that's why it's always good to get some professional advice when you're starting a serious exercise regimen. Using walking sticks or canes can be helpful. When you're exercising, you can expect minor discomfort. The key word is minor, because if you have pain 2 hours after exercising, more than when you started, then you're not doing something right. You should seek some expert advice. Okay. So if you're doing too much too soon, if you're holding your breath when you're exercising, or you're taking extra medication unless your doctor suggests it, these are things that are not a good idea to do, which is doing too much too soon, holding your breath when you're exercising, taking extra medicine, only if your doctor tells you to. Okay. Should you use moist heat or cold heat, or cold pack? Some people like moist heat. A warm, hot towel sometimes is all you need to do. Others like cold therapy, an ice pack over an area. So that's a personal preference. They both seem to work. But if you've started an exercise regimen on your own and you're noticing you have unusual or persistent fatigue, you increased weakness, decreased range of motion, your joints are swelling more, you have more pain an hour after exercising than before you started, you should stop and speak to your doctor and get referred to a physical therapist first. As almost a last resort is when your physician will recommend surgery, and there are certain types of surgery that they do. But before you do surgery, they will have you consider all these things. They'll work with you, of course, like how long is your recovery period going to be? Will you need help at home? Do you live alone? How long will you be disabled? How long physical therapy? How long to return to normal activity? All those things they will work with you on before deciding to go to full surgery. Arthroscopy is probably the most common of the surgeries they will do first. This is really considered minor surgery. Somewhere near the joint, they will make a small incision the size of a buttonhole, and they'll insert a tube down that hole, and at the end of that tube is a small camera, and your doctor then can send back pictures to a TV screen to look at what the condition of the joint is, and then he can even attach surgical instruments to the end of the tube and perform minor cleanup if the cartilage is all over the place, and he can do abrasion and many other things to help relieve some of the pain. They can also do osteotomy surgery. As you can see here, sometimes the bones, where the two bones meet, they are not aligned properly anymore because the tendons and the muscles around have weakened so much. And when the two bones do not align properly, there can also be pain. So they can shave some of the bone at the joints to decrease pain and make the bones align better. And then, of course, a full knee replacement or a full hip replacement. On the left is a knee replacement where they've taken out both ends of the knee, including all the surrounding joint material, and put in an artificial joint. The hip now they're getting very good at. Hip replacement will give a lot of people a lot of relief and so on. Now remember, a hip replacement is not the same as repairing a hip fracture. If you break a hip due to osteoporosis or anything else, that is a very serious situation, and repair of that is very difficult. But replacement of the full hip is something that our surgeons are getting very good at today. Okay, so we've talked about these things already. I just want to very quickly go into a brief quiz. Eating oranges and grapefruit triggers osteoarthritis pain. What do you think? Do you think foods like oranges and grapefruit can trigger an osteoarthritis attack? Probably not. Okay, because remember, these foods do not cause inflammation. It's only foods that cause inflammation. Okay. Which has been shown to soothe osteoarthritis pain? Oh, I neglected to mention that some recent data has come out to show that especially older people who have osteoarthritis frequently also have the co-occurring disorder of mental depression, because now you suddenly cannot move around as well. You may get depressed and may become more anxious and so on. So doctors today, when they're evaluating your osteoarthritis, are very aware and are looking for signs of depression and anxiety. So music has been shown to help some of the anxiety and not to trigger another attack. So in this case, the answer would be to soothe osteoarthritis pain. Soothing music sometimes may help. If you have pain and fatigue, you should avoid physical exercise. And the key word here is avoid. Is that true?
True.
Very good. It's not true. You should not. You should only avoid physical exercise during the extreme attacks, but when the pain is improved, you should also go back to your exercising. Okay. Who is at risk for osteoarthritis? A football player, woman over 70, data entry clerk with also always that constant repetitive motion, an overweight man, a bricklayer. Who do you think?
Everybody. Over 70.
Actually, all of the above.
All of the above.
Because remember, people who are football players, they probably have damaged their knees in their youth. And bricklayers, people doing repetitive motion, like entry clerks and so on. they're all at risk. The key word is at risk. Doesn't mean they will definitely get it.
Okay.
It's only osteoarthritis if the pain is in your knee or your hip. Is that true?
False.
No.
False.
It's false. Very good. Because remember those 5 places in your cervical spine, around your neck, in your hands, and in your feet also. Which is the best for relieving osteoarthritis pain? Heat, ice, or heat or ice, or alternating between heat and ice?
Heat or ice?
Very
Alternating
good,
ice and
very
heat.
good. Heat or ice. Remember, some people like a moist,
Heat
warm
over.
towel. Other people like an ice pack. So they both can work. Regularly eating foods like hamburgers and French fries can make your arthritis pain worse.
True.
True.
True, very good. For those foods may cause inflammation, and that may increase the pain. A knee brace could reduce your pain.
True.
Very good, true, because that will give you some support, especially when you have lost the strength of the muscles surrounding your joint. How much extra stress does each pound of body weight put on your hips?
6. 1 pound equal to 6 pounds.
8 times more.
6 times, yes, 6 times as much. 4 times as much on your knees,
Okay,
but
6
6
times.
times as much on your hips.
Oh.
Physical therapy is no better at reducing arthritis knee pain than exercising on your own.
No, it is better.
False.
False, because the physical therapist will probably teach you some extra tricks at improving and strengthening the knee. Okay, exercising on your own is okay once you've gotten some guidance from them. Why would your healthcare provider prescribe a pain reliever? So your joints can heal, to help you fight infection, so you can
Number
be
3.
more active.
More 3. Number 3.
Yes, so you can be more active.
Active, yes.
We want to give you a little more pain relief to increase your motion, and that will increase your strength and eventually decrease the pain. If you have osteoarthritis, you'll be taking anti-inflammatory medications for the rest of your life. This is a tricky question.
It's false, but could
False,
be true.
very
too.
good. False, because we don't want to be regularly using these medicines. We want them only occasionally, because some of these medicines, remember, can be very effective, but very dangerous with side effects like bleeding in your stomach and so on.
Ulcers, causing ulcers.
The supplements glucosamine and chondroitin may relieve arthritis pain in some people, slow the progression of arthritis in some people, repair cartilage damage, or all of the above.
All of the above, I think.
No, slow the progression of the arthritis in some people.
Actually, it cannot do that either. It only can relieve arthritis pain in some people. Not everybody responds to this. Remember, we talked about glucosamine and chondroitin. We don't understand why some people will respond to it for the pain and maybe even the stiffness, but not everybody will respond to it.
It's not a pain relieving.
Strength training is the only exercise that can reduce arthritis pain.
False.
False.
Very good.
False.
Yeah. It's just one of the ways. You just want to increase the strength, but you also want to keep that joint moving, and just a healthy lifestyle in general, which can lead to better sleep a better rest, better diet. All those things can be a result of good, solid exercise, regular exercise. Acupuncture has been proven to relieve arthritis knee pain. The key word here is proven.
False.
False, very good. It's not proven. Some people may get a little bit of relief because the inflammation might go down, but it's not
Temporary.
proven because there's no good studies on this at all.
No.
A good night's sleep can reduce your arthritis pain.
True.
Very good. Very good. You must have good rest so that the next day you can do a healthy lifestyle again. Okay. And so we'll end here, and we show you this guy who showed up with a big inflamed knee. And the secretary wants to know why he's here today to see the doctor. Pretty obvious, isn't it? I think we have time for just a few questions, right, Sayeda?
Yes, we do. Yes, we do. If anyone has questions, they're welcome to either raise their hand or type in the chat box, or you can speak up.
My question is, can I speak?
Sure,
Yes,
go ahead.
please do.
You know, when you have the arthritis in your fingers, in the
Yes.
joints in your fingers, can that be, you know, the fingers become so crooked and they're not presentable, like you don't feel like, you feel like hiding your hand all the time.
Yes.
Is there
Yeah,
anything?
I think you said, can that be reversed? Can you have your deformation of the finger joints reversed? Is that your question?
Or reversed or repaired or set right,
Yeah.
you know?
Unfortunately, no. Those are probably permanent. However, you don't want it to get worse. So what you do is you can do exercises of the fingers. And the most common one is squeezing a tennis ball. A lot of doctors will tell you to do that. Just when you're watching TV or when you're on the phone with somebody, just whenever your hands are idle, squeeze a ball. That will prevent it from getting worse. But to reverse it, it's probably not possible. But by squeezing a ball and doing that as frequently as you can might help. And work with your physical therapist. They have other exercises as well that can help you not get that condition worse, and you want more flexibility.
Like in the morning, when I open my hand, the middle finger, it just gets locked. It doesn't open up. And after some time, it opens with a big, you know, like as if you're with a big, what should I say, motion that finally it becomes less. But in the morning, it is very stiff.
Yeah.
Well, I have the same thing. I have they call it hammer finger, right? Just like hammer toes.
Yes.
It locks up and then I have to pull it loose.
Yes.
So is there any way to relieve that or to stop it?
Yeah, well, once again, stiffness is a very much of a component of osteoarthritis, and regular exercise may decrease the frequency of it. So work with your doctor, ask for a referral. Next time you see your doctor, ask him for a referral to a physical therapy so they can start giving you some ideas on what are the better exercises to do for your hands. A lot of people will get cramps and so on in their feet and their legs also, especially after sleeping all night. That is very common, and it's all part of the decreased circulation as we're lying motionless for many, many hours. And so keeping your body well lubricated by doing the right forms of exercise can help. Yes.
Okay, thank you so much.
Okay, I have a question. Recently, I'm having a pain in my both wrist.
In your ribs?
Wrist, arm.
Oh,
finger,
wrist?
Wrist, yeah.
Uh-huh. Yeah, remember, carpal tunnel syndrome is part of the arthritis family of conditions.
Mm-hmm.
Have you seen your doctor? Because your doctor can take an X-ray and see what's going on.
Doctor has taken X-ray, but he thinks it's arthritis.
Okay, yeah. So next time you see him, ask him to refer you to the physical therapist to learn the correct exercises for that joint.
Okay, all right, thank you.
Uh-huh.
There is a question about, can tomatoes cause inflammation? Do the drug treatments only address symptoms, or do they also cure arthritis? So there are two questions basically.
Can tomatoes are inflammatory?
Yes.
Gee, I'm not positive on that one. Sayeda, can you help us?
Tomatoes are actually anti-inflammatory. They have vitamin C and lycopene.
Yes.
So they are considered anti-inflammatory. So that answers that question.
Good. Thank you, Sayeda.
Of course. And do the drug treatments only address symptoms, or do they also cure arthritis?
Can what?
Do they cure arthritis?
Is there a cure for arthritis?
Yeah, drug treatments, do they just relieve symptoms or do they cure?
No, right now, there is no cure for arthritis. They're working on some innovative stuff, like using gene therapy and looking at other, what they call autologous solutions, where they're using stem cells to try and create production of cartilage. But we're years away from that. Those are all theoretically possible and will become a cure for arthritis. Unfortunately, right now, there's only decreasing pain as treatment. And we can do that with a lot of people quite successfully, because remember, when you decrease pain, you're going to increase the range of motion. And when you increase the range of motion, you decrease stiffness. It's that vicious cycle, right? So indirectly, we will not cure it, but we can decrease the morbidity of the disease. Did that kind of answer the question?
Yes.
I have a question.
Go ahead.
And please, can I ask?
Go ahead. We can take one more question. Yes.
What precautions should we take at an early age so that we can prevent osteoporosis?
I couldn't hear the question.
Later?
What is the what?
I said, what precautions can we take at an early age?
Oh,
say from 40
very
onwards?
good question. Yeah, very good question. What precautions can you take at an early age? That question has come up before, and it's healthy living, keeping a healthy body weight will help. However, there's no guarantee, even if you're doing that, because they think there's a genetic and a hormonal component to this condition. So if you exercise regularly, you take two people, one, they both exercise the same way, they're both not overweight, and they both end up one with arthritis and one without. So it implies there is a genetic component as well as that hormonal component, which may affect inflammation and how rapidly cartilage is broken down. But it cannot hurt to always lead a healthy lifestyle, even when starting from very young. Not to get overweight, not to be sedentary, and so on. And then if it still happens, maybe it won't be as severe as if it were to happen without the healthy lifestyle.
Yeah, thank you so much.
All right. So thank you, everyone. And Dr. Bill, thank you for joining us again. And
Thank you
sharing
so much
such
for having me.
informative topic.
Thank you so much.
I appreciate you all. And I would also wanted to add that we have some new members I see joined in. If you are new to Olive, please register on our website at www.olivecs.org, and you simply go register for free, and you get weekly emails with all these types of amazing programs for different topics, different interests for you weekly, 3 times a week, including exercise on Tuesdays. And I believe Dr. Bill will be coming back and talking about, I think, inflammation or GI, if I'm right, in December or so. So Dr. Bill, it's always a pleasure to have you with us.
Thank you so much. So I
we
will
look
be
forward to
leaving
it.
now.
Yes.
Thank you again. Thank you.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.